nim nango ibigay King. Good evening, everyone. Thank you for coming out this afternoon. I'll try and speak as loud as I can. We are expecting a sound system to come so that you can talk in my normal voice. But I do want to thank you for coming in today to listen to this very important subject area that concerns not only the health of our people but the health of people around the world. And as you've seen, a number of places where people gather, sports leagues, educational institutions, they've all made decisions to ensure that the spreading of this COVID-19 virus doesn't affect too many people at once. They want to try and contain it. And with the knowledge that we do have in our community, and we're fortunate that we have a number of people that work in this area on our behalf and have gathered the information. I've, based on a lot of the information that was available and the relative proximity of where the virus has now been confirmed in Sudbury. And I do have to say that I've been hearing a little bit of concern about rumors in our community that people are sharing info that there's infections in our community, and that's not the case at all. So I want to start off with that. There are no COVID-19 cases in Wikwemikong. Everyone hear that? So, and even if there was, the health center would be notified immediately by Health Sciences North or the medical laboratory in Toronto that does do the testing, and she would give me the information also, and I'd be sharing that with you as it comes up. And the fact of the matter is that one way or another, some of us are likely, and maybe all of us at some point in time, will get exposed to this. That's just a fact of it. Sometimes some years you might get the flu, other years you don't get it. But the flu is always there, and that's kind of what this is. But because it's so new, a lot of the medical professionals that have worked on creating vaccines, they haven't had an opportunity to do that yet. They are working on it. At least that's what I'm being told, and that's coming from the World Health Organization. And in their release yesterday, they've indicated that work continues. So right now the risk level is still fairly low. However, through my request, through our Director of Operations, who couldn't be here tonight with us, I'd asked for our staff to come together from our emergency control group. So yesterday we had a conference call so I highlighted to Mary Jo and the health center staff that I wanted to get prepared and get ahead of this situation as quickly as possible because of the widespread panic that I'm hearing about and all the rumors, and we need to put that to rest. And because the discussions were happening not only in our community but other communities across the province. And as you know, as a result of some of the decisions that have been and the positions taken by some of the sport governing bodies and universities and governments, The Little NHL also followed suit, where they canceled next week's gathering, next week's hockey tournament for this year. And I do know that it's not a decision that they took lightly either. And I do have to commend Marian Jocko, who's from our community, who's the president of Little NHL, as well as Chief Scott McLeod from Nipissing First Nation, the host community. They were in constant contact with the health authorities in the Peel District, Mississauga, the city of Mississauga, and they were continued to be advised that the risk levels were low, which is why they were trying to, as much as possible, carry on with business. However, it seems that the approach is one of that many jurisdictions are now looking at containment. So wherever there is an infection, that they're trying to isolate it so it doesn't spread into further locations. So Little NHL is one example that was canceled. All the major sporting teams, those leagues have all suspended their operations until further notice. The provincial government, Ontario provincial government, just half an hour ago announced that they're extending the March break for students. So the students will be out for March break in provincial schools from March 23rd to April 6th. So they'll have essentially a 3-week March break. So it's something that we're going to evaluate and consider as one of our approaches, because we're essentially we don't want to be in a reactionary mode, but we want to be on top of the issues, and we want to make sure that it doesn't spread into our community, and we want to make sure that we protect everyone. So I do have to thank Mary Jo Wabno, our health director, and Teresa Pongush, who's been working diligently over the last few months anyway, for the last few months in gathering the information. And on Monday, she had coordinated a meeting with some of the frontline staff to make sure that we're looking at every single possible issue that we need to. So a lot of that information has been put together, and a lot of it is, when you're walking in the door, is available for you. So Teresa is our lead, along with Mary Jo at the Health Centre. And if you do have any follow-up questions, don't hesitate to call the Health Centre and speak to Teresa. She's been researching the subject, and if she doesn't have the answer, she'll make sure that she finds it for you. So we do have to, and I want to really join me in giving the Health Centre and the rest of the staff here a round of applause for coming together. So one of the main message that is being shared by all the medical professionals is that we have to maintain our levels of hygiene, and we're going to have to change some of our habits. What is the best recommended course of action? So we probably can't be shaking hands with everybody anymore. If you shake hands. So when Linda coming in, we touched elbows. or if I seen Shane over there, I went like this to him. So those are some of the common, what should be common sense for us to protect ourselves. We don't know exactly where or who has been exposed to any of this virus. we do know, and I'm going to let Teresa go through her presentation to share more in depth on the actual virus itself. But what the information is that a person isn't contagious until they are showing symptoms. And I've asked our staff to share information on the difference between a head cold, the difference between the flu, and the symptoms of this COVID-19. And we do have to be very careful because our health staff, whether it's here at the health center or Manitoulin Health Centers, both in Little Current and Minnemoya, or at Health Science North in Sudbury, the healthcare staff are there to help us. So we don't want to unnecessarily expose them when we don't have to. And what the health facilities are asking for is to provide a warning, to make a phone call, let people know in the community, the staff and the health professionals, that you are feeling these symptoms. Let them know so they can prepare to provide you some advice. So there's staff at our health center that can field those phone calls. Emergency departments will also take those phone calls. Ontario Telehealth will take those phone calls, as well as the Sudbury District Health Unit will also take those phone calls. So we do have to make sure that we're all doing our own part. And it's necessary for us to do these, because what we do know about this COVID-19 is that it does affect those with that are already frail or have pre-existing conditions, like diabetes, like heart disease, those with pneumonia, those with that have lung issues, asthma. Those are the ones that are really at risk. So we do have to make sure that we're continuing to be mindful that people do have these issues in our community, and we need to continue to protect them. I do also caution that to really understand what this COVID-19 is, what the symptoms are, because we don't want to overwhelm our health center staff also. We each have an individual responsibility to understand what illness that we're afflicted with. Which is why I say let's start looking at what a head cold is, what the flu is, and what COVID-19 is. Understand what those symptoms are. And if you anticipate or suspect that you might have some of those symptoms, reach out immediately through telephone. Take steps where you're beginning to isolate yourself in your bedroom. Wash everything, start disinfecting everything. And I do have to say that we've come together, but this also isn't necessarily a state of emergency. This is a precautionary information sharing session to get ourselves prepared as the staff here in the community, but also to provide you with the right information. And we're going to aim to the emergency control group, the staff that are here are aiming to come together at least weekly for the next foreseeable future. And that shortly after that meeting, I will be providing an update, or if an update is necessary in between those times, I will be doing that update. I will be providing you with the information. And it may not be a setting like this, and it's likely going to be over a videotape message. Maybe we'll generate more sales for TV bingo. You have a captive audience. I'll do it before the bingo. Or that one last number that's flashing. That's when I'll start talking. So we've been, the staff have been looking at all the issues in depth. We're considering all of our options, taking all safety precautions. We're considering limiting travel. We're considering limiting bringing visitors in, consultants that work with our communities, that do training. These are some of the things that we have to look at to protect our community. But we also need to carry on with our day-to-day affairs. We need to carry on our business. We can't live in fear. One of the things that the medical professionals have been saying also is that they don't have enough information on this COVID-19. One of the questions is, how long is this going to last? The best knowledge that we have right now is that it survives for at least 14 days, 2 weeks. Which is why most of the governments and all the people that have been making announcements are either canceling events or suspending operations for the next few weeks in order to contain and limit the amount that this virus is spread. So we do have to work together. We do have to be patient, and with the information that is being shared, it's the best information that's out there. So this is the information that we should be relying upon, and not my neighbor on Facebook. These are the reports that have been assessed and researched by the health center, and this is the information that's the best that's out there. So we're looking at this because we're taking this matter seriously. We want to make sure that it doesn't spread unnecessarily throughout our community. And as you know, other Anishinaabe communities are also having these kinds of sessions, and also implementing canceling out-of-town trips, canceling hockey tournaments, doing what they can. But we need to continue to help each other and work through this together, because that's how we do it. That's how we've always done it. We always help each other. So I do want to say, I think that we do have to be diligent. We do have to continue practicing washing our hands. If you don't have hand sanitizer, washing your hands with soap for 20 seconds is what's recommended. It should be something that you're doing anyway. These are things that are going to limit the spread of this COVID-19. So with that, I want to offer up. I want to ask Teresa here to go through the presentation. Maybe I'll ask Mary Jo first to have a few comments, and then Teresa can go into the presentation, as well as Yvette. And we're going to have other presentations, not only from the health center, but the chief of police, education, and from our nursing home. Miigwech.
Miigwech, Kema. And miigwech to the community for taking the time out of your evening with your families, and also bringing your families here this evening to learn those precautionary measures that we've been teaching for the last couple of months for sure, because we've had it out there in the newsletter, our Facebook, the YouTube, different things, different modes of getting this information out to keep our community members informed. We have been working pretty diligently over the last couple of weeks for sure, getting all this information together. Not only myself, but Teresa and Yvette have been attending our Manitoulin Island network of healthcare providers. So we're part of this group on Manitoulin, and we've come together and had these conversations about the what ifs and how do we plan for and how do we come together to support one another. So we're looking at that overall for Manitoulin. So just not our community, we're looking at the whole of Manitoulin Island. Monday we had the opportunity to walk through our pandemic planning session, and this is where again more conversation came out, and we, as working within this element, we had more questions, so that allowed us to prepare for tonight, because there were people around the table that were asking more specific questions. So again, it gives us that chance to go through it, live it, meaning go through the scenario and experience that scenario. And that's what we're going to walk through today. And it's important for the community to be able to listen to those questions and listen to the feedback. And Teresa's going to, give you some of those, the teaching on how to keep yourself safe, keep your family safe, and how to support one another should the event happen, that somebody within your circle does come into contact with COVID-19. So I don't want to take up much time on addressing the whole process. Yuma did a whole overview of what we've done to date. Yes, we did have our emergency control group meeting this morning. So we went through that process, and then we met with all the managers within Wikwemikong and City Territory. So we're all briefed, we're all aware, and to proceed with this evening's meeting, coming together as a large group, there was some question about that, but it's important that we come together and learn about how we're going to take care of ourselves to support one another. So I'm going to pass it over to Teresa, and yes, I totally acknowledge the whole health center staff, all of our support staff. We have our admin support, we have our med trans drivers, we have our nurses, our all the staff. Everybody has a part to play, not only within Wikwemikong, but within all of our organizations, because we need to support one another. So I'm going to pass it to you. Do you need the microphone? Oh, yeah, I think so. So welcome to Teresa.
Hello everybody, thank you for coming out, and we'll get started with the presentation. So as we know, Little NHL's been canceled. Get that out of the way.
And bingo.
Oh yeah, and bingo?
Yeah, bingo.
Good to know, and bingo as well, guys. So how will I know it's COVID-19 or the flu? So this is one of the things that Okama mentioned earlier about teaching and making sure that you guys understand the difference between COVID-19 and what the common flu is. So this is one of the handouts that is at the front with Tia Babamque. You want to give them a little wave, Tia? There she is over there. Yeah, so she's got the handout on this one. If you haven't picked it up, please go see her. Maximize a little bit. So this one goes over the influenza symptoms. So you're going to have symptoms of respiratory disease with a wide range of illness from asymptomatic or mild through severe disease and death. And this is how it will present clinically. Mode of transportation and public health measures it'll spread through contact, so droplets and fomites. So fomites is just a fancy word for saying that you coughed and sneezed on something and the virus is now on it, and then you go and touch it, bring it up to your eyes, your nose, or your mouth, and you have the virus. Prevention will include hand hygiene and good respiratory etiquette, so that means covering your cough, covering your sneezes, and just making sure that you're not projecting it across the room and sharing it with others. Median incubation period for the flu is 1 to 4 days, so a mean of 2 days, versus COVID-19, which is 5 days. So you see the big difference there? Serial interval, so the time between successive cases is 3 days for the flu, which can spread faster than COVID-19, which is why we work so hard to try and get the flu shot out there. So if you haven't gotten your flu shot, please come see us. We do have flu vaccines available at the clinic, but it's important to note that the flu shot will not protect you against coronavirus. Again, COVID-19 vaccine development is still in process. They're still working on it. We aren't there yet, and hopefully we'll get there soon. So a major driver of transmission for the flu is the first 3 to 5 days of illness, where you're pre-symptomatic transmission. Children, adults are infected from children, so children are a common sharer of the flu, versus COVID-19, where children are infected from adults. So it's almost the other way around. Severity, the burden of severity for influenza varies every year, and globally, an estimated 0.3% to 5.5% of influenza cases are severe. With COVID-19, 80% of the infections are mild or they are asymptomatic, whereas 15% are a severe infection where you might require oxygen therapy. 5% are critical infections which require ventilation. So this is where you're hearing stories of people having to go to the hospital, winding up in the ICU, needing a ventilator or further treatment. So the most at risk for the flu are children, pregnant women, the elderly, and anybody who has underlying chronic medical conditions, or if you're immunosuppressed. For COVID-19, the most at risk are those of older age, so those 60 and over, and if you have underlying chronic conditions like Ogama mentioned, so you're having chronic lung problems, again, diabetes, any other underlying chronic conditions. And the mortality rate for the flu is usually well below 0.1%, whereas with COVID-19, it's higher, so 3 to 4%. And for treatments for the flu, we have the antiviral medications. So we have Tamiflu, which is used to treat influenza. We don't have anything yet for COVID-19. So this is what we know so far about COVID-19. It was identified on December 31st, 2019. It was located in Wuhan, the Hubei province in China. The coronavirus origin was from live wet market in the cluster of pneumonia cases. And it's a new respiratory virus that causes cough, fever, or difficulty breathing.
The investigation found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early, and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus could change. Please check the websites below for the most up-to-date information.
So this slide just basically goes in and recaps everything that was in that video. So we know it was detected in Wuhan, Hubei province in China on December 31st, 2019. We know it is genetically distinct from common human coronaviruses, and that the incubation period is still unconfirmed, but we know of the 14-day self-isolation for positive cases. That infectivity and asymptomatic transmission is still largely unknown. Transmission via droplets and through close contact, person to person within 2 meters. You can have mild or severe symptoms of the fever, cough, and difficulty breathing. Risk factors for severe symptoms include being aged more than 60 and older, basically. If you have underlying chronic respiratory issues, underlying chronic conditions like diabetes and cardiovascular disease. They're advising to seek medical attention if you have chest pain or trouble breathing. Treatment is supportive care, but treatment options are being studied in China through traditional and Western methods. And there's no vaccine available, but it's currently under development.
COVID-19.
So again, to recap, you can have mild to severe symptoms of fever, cough, shortness of breath, or difficulty or trouble breathing. Risk factors again, you're 60 years of age or older, you have underlying chronic conditions, chronic lung problems, cardiovascular disease, and diabetes. Transmission is through droplets. So when you cough, you sneeze, or you touch contaminated surfaces, and then you bring that to your eyes, your nose, or your mouth, which is called your T-zone. The incubation period is for 2 to 14 days after exposure. Recommended self-isolation period is 14 days. Treatment again, supportive care unless you require further interventions due to difficulty breathing or you develop a co-infection like pneumonia. Recovery is 80% of cases which go on to recover, with those 20% being severe cases. This just recaps everything again. So to reiterate what Ogama said, contracting this virus is still low for Ontario at this time, and you have a better chance of contracting the seasonal influenza during the cold and flu season. So Mythbusters. So from the evidence so far, the new coronavirus can be transmitted in all areas, including areas with hot and humid weather. So regardless of climate, adopt protective measures if you live in or travel to an area reporting COVID-19. The best way to protect yourself against COVID-19 is by frequently cleaning your hands. Wash your hands. Eliminate viruses that may be on your hands and avoid infection that could occur by then touching your eyes, your mouth, and your nose. So again, the T-zone. This is the fact. The new coronavirus can be transmitted in areas with hot and humid climates. Here's another fact. Cold weather and snow cannot kill the new coronavirus. There's no reason to believe that cold weather can kill the new coronavirus or other diseases. The normal human body temperature remains around 36.5 and 37 degrees Celsius, regardless of the external temperature or weather. The most effective way to protect yourself against the new coronavirus is by frequently cleaning your hands with alcohol-based hand rub or by washing them with soap and water. All right, so fact, taking a hot bath does not prevent the new coronavirus disease. Taking a hot bath will not prevent you from catching COVID-19. It goes over your normal body temperature again. It says actually taking a hot bath with extremely hot water can be harmful as it can burn you. The best way to protect yourself against COVID-19 is by frequently cleaning your hands. By doing this, you can eliminate viruses that may be on your hands and avoid that infection of bringing it up to your eyes, your mouth, and your nose. Again, fact, the new coronavirus cannot be transmitted through mosquito bites. I know, right? To date, there has been no information nor evidence to suggest that the new coronavirus can be transmitted by mosquitoes. They're not even around yet. Are hand dryers effective in killing the new coronavirus? No. Hand dryers are not effective in killing the 2019 nCoV. Can an ultraviolet disinfection lamp kill the new coronavirus? UV lamps should not be used to sterilize hands or other areas of skin, as UV radiation can cause skin irritation. How effective are thermal scanners in detecting people infected with the new coronavirus? Thermal scanners are effective in detecting people who have developed a fever. So if you have a higher than normal body temperature because of infection with the new coronavirus. However, they cannot detect people who are infected but are not yet sick with the fever. This is because it takes between 2 and 10 days before people who are infected become sick and develop a fever. Can spraying alcohol or chlorine all over your body kill the new coronavirus? I'm telling you guys, I don't know where they come up with this stuff. No, spraying alcohol or chlorine all over your body will not kill viruses that have already entered your body. Spraying such substances can be harmful to your clothes, mucous membranes, your eyes, your mouth. Be aware that both alcohol and chlorine can be useful to disinfect surfaces, but they need to be used under appropriate recommendations. Talk about that later. Do vaccines against pneumonia protect you against the new coronavirus? No. Vaccines against pneumonia, such as pneumococcal vaccine and Haemophilus influenza type B Hib vaccine, do not provide protection against the new coronavirus. This virus is so new and different that it needs its own vaccine. Researchers are trying to develop a vaccine against the 2019 nCoV, and the WHO is supporting their efforts. Although these vaccines are not effective against 2019 nCoV, vaccination against respiratory illnesses is highly recommended to protect your health. So if you haven't gotten your Pneumovax recently, please come see us. Can regularly rinsing your nose with saline help prevent infection with the new coronavirus? No. There's no evidence that regularly rinsing the nose with saline has protected people from infection with the new coronavirus. There's some limited evidence that regularly rinsing the nose with saline can help people recover more quickly from the common cold. However, regularly rinsing the nose has not been shown to prevent respiratory infections. Can eating garlic help prevent infection with the new coronavirus? I'm going to do a shout out to Gary. He says garlic solves everything. Garlic is a healthy food that may have some antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from the coronavirus. Does the new coronavirus affect older people, or are younger people also susceptible? So people of all ages can be infected by the new coronavirus. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease appear to be more vulnerable to becoming severely ill with the virus. The WHO advises people of all ages to take steps to protect themselves from the virus. For example, good hand hygiene and good respiratory hygiene. So covering your cough and covering your sneezes. Are antibiotics effective in preventing and treating the new coronavirus? No. Antibiotics do not work against viruses, they only work against bacteria. The new coronavirus is a virus, and therefore antibiotics should not be used as a means of prevention or treatment. However, if you are hospitalized for the 2019 nCoV, you may receive antibiotics since bacterial co-infection is possible. Are there any specific medicines to prevent or treat the new coronavirus? To date, there is no specific medicine recommended to prevent or treat the new coronavirus. However, those infected with the virus should receive appropriate care to relieve and treat symptoms, and those with severe illness should receive optimized supportive care. Some specific treatments are under investigation and will be tested through clinical trials. The WHO is helping to accelerate research and development efforts with a range of partners. So how to protect yourself against COVID-19.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth. since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
So this one is, when should I use a mask?
Medical masks like this one cannot protect against the new coronavirus when used alone. When you wear them, you must combine with hand hygiene and other protective measures. WHO only recommends the use of masks in specific cases. If you have cough, fever, and difficulty breathing, you should wear a mask and seek medical care. If you do not have these symptoms, you do not have to wear masks, because there is no evidence that they protect people who are not sick. However, if you are healthy, but you are taking care of a person who may be infected with the new coronavirus, then you should wear a mask whenever you are in the same room with that person. And remember, if you choose to wear a mask, use it and discard it properly, and clean your hands with alcohol hand rub or soap and water. For more information on mask use, other preventive measures, and the new coronavirus, check WHO website at who.int. Thank you.
So this one is, how do you take a mask off? So how do you put on, use, and take off and dispose of a mask? So to take off the mask, you remove it from behind. You do not touch the front of the mask. You discard it immediately in a closed bin. You clean your hands with an alcohol-based hand sanitizer or soap and water. So what can you do to protect yourself and others against COVID-19?
There are several measures you can adopt to protect yourself and others from getting the new coronavirus. Frequently clean your hands by using an alcohol-based hand rub product like a gel, or wash your hands with soap and water. When coughing and sneezing, cover your mouth and nose with flexed elbow like this, or use a tissue. If you use a tissue, discard it immediately into a closed bin. Avoid close contact with anyone that has fever and cough. And if you have fever, cough, and difficulty breathing, seek medical care early and share information about any recent travels with your healthcare provider. If you just have mild respiratory symptoms and no specific travel history, carefully follow the precautions I just explained and make sure you stay home until recovered. If you need more information on how to protect yourself from the new coronavirus, check the WHO website at who.int.
Welcome to WHO. This is an opportunity for you to ask the questions you want answered about the COVID, the disease caused by the new coronavirus. Welcome to WHO. This is an opportunity for you to ask the questions you want answered about the COVID, the disease caused by the new coronavirus that has caused outbreaks in a number of different countries. I'm Dr. Margaret Harris, and I'm here today with Dr. Maria Van Kerkhoff, who's our expert in coronaviruses and respiratory diseases, and is here to explain what you can do to protect yourself. Over to you, Maria.
So hi everybody, thanks for having me. Yes, I'm with the World Health Organization, and I'm the technical lead for this novel coronavirus outbreak called COVID-19, which I'm sure you've heard a lot about.
So I'm going to ask Maria a few questions, but we'll also offer you the chance to ask your questions via Facebook and via Twitter. On Facebook, I'll give you the way to ask your questions. You can do it via the comments section, and on Twitter you can ask your questions by using the hashtag AskWHO. So Maria, what can people do to protect themselves if they're in an area where there's currently an outbreak of COVID?
Well, thanks, Margaret, for this question. This is a really important question because there's many things that you can do as an individual to protect yourself and to protect your family against this novel coronavirus. The first thing is very simple. The first thing is to wash your hands regularly. And it sounds very simple, it doesn't sound very exciting, but it is incredibly important that you make sure that you wash your hands with soap and water, and make sure you get your kids to wash their hands as well. And if you don't have soap and water, you can use an alcohol-based rub. That's the first thing. The second thing that you can do is what we call practicing respiratory etiquette. And what that means is when you sneeze or if you cough, that you do that in a folded elbow, and you sneeze or cough into your elbow, or you use a tissue, and then you throw that tissue away, and then you make sure you wash your hands. And the third thing that is really important is to educate yourself. So make sure that you have the latest information about novel coronavirus, about COVID-19, from your parents, from WHO, from trusted sources, and make sure that you know what the latest information is about this. This is a rapidly changing situation, and every single day we are learning more and more about this virus. And so the more we learn, the more we want you to know about this. And by educating yourself, by knowing more about this, you can make sure that you protect yourself and you protect your family.
But it's not so easy, really, to always wash your hands, to keep those hands clean. And there's another secret, isn't there, Maria? How does the virus get into your body? Whereabouts is it?
So yes, washing your hands is difficult, and it is something that you have to do many, many times a day. And as a mom myself, I know I tell my kids all the time to wash your hands and wash your hands regularly before you go to the bathroom, after you go to the bathroom, when you're cooking food, before you cook food, after you eat your food. You have to do that many, many times a day. But this is a respiratory virus. This is a coughing respiratory disease, which means that many people have signs and symptoms like the common cold almost. They'll have fever, they'll have cough. Some people may have shortness of breath, which means that their chest hurts a little bit and it's hard for them to breathe. But what we know about this virus is how it transmits between people is through close contact and through respiratory droplets, which means you have to be close to one another within a meter or two, which is 3 to 6 feet. And if I were to sneeze right now on you, or cough on you right now, I would pass some droplets to you. And those droplets could go into your eye, they can go into your mouth, into your nose. So you have to make sure that if you do cough, you cover your mouth so that those particles, those droplets, those little droplets don't actually infect someone else.
So when should people be wearing a mask?
So that's a good question. So there's a lot of people, WHO recommends that you wear a mask if you're sick. So if you have respiratory symptoms, what you do is you wear a mask, and there's important ways in which you put the mask on and off, and we have some good videos that show a proper way to put it on and off. But you're using a mask to protect other people. So if you have symptoms, you're protected, and you wear a mask, and you protect yourself from getting those droplets onto other people.
And what happens if you're, say, coughing into your mask and it gets very wet at the front?
You need to replace your mask. And so this is a hard one because we do see a lot of people wear masks and they rewear them. So it's important that you take them off from the sides. You don't touch the front. You take them off from the sides, discard them, wash your hands, and put another mask on.
And when you discard them, you would make sure that you discard them somewhere safe, that's covered?
That's right, in a bin that is covered. Yes, that's right.
So we have quite a few questions, a lot of questions pouring in. Thank you to everybody who's watching and asking brilliant questions. I'll start with one from Casey Carmichael. Thank you for your question. You're asking, why don't you recommend longer quarantine than 14 days? Is this because are there false negatives and outliers? Should we have a quarantine longer than 14 days?
So thank you, Casey, for that question. That's a good one. What we recommend is for when you do contact tracing that you have to identify the cases, you identify their contacts, and then you follow them for a certain number of days. And the important number of days has to do with what we call the incubation period, which is a big fancy word that basically means from the time that you are infected to the time that you develop symptoms. And 14 days is the upper end of the incubation period that we are following. We believe that most people will show symptoms after infection about 5 or 6 days after they are actually infected. And yes, there are possibly some outliers or some upper numbers, but what we look for when we try to find that number is we look for case pairs. So if I'm a case and you are one of my contacts, then we follow you for a certain number of time to determine how long it takes for you to develop symptoms. And that's actually very hard to do in an ongoing outbreak. So we are constantly looking at data that's coming from countries, and as of right now, we feel very firm and confident that 14 days is the right upper bound.
And you mentioned symptoms.
Mm-hmm.
What symptoms should people be looking out for?
So the symptoms that you should be looking out for are respiratory symptoms, so signs and symptoms. So a cough, dry cough, shortness of breath. Very few people actually have a runny nose or sneeze. I've just recently returned from China, and I've just spent 2 weeks in China working with incredible colleagues that are working very hard to really understand this outbreak. And what they've learned from more than 70,000 cases in China is that very few people actually have runny nose or actually sneeze. Most people will have a fever, most people will have a cough, and then some people will feel generally unwell, they'll have maybe some muscle pains. And what we do worry about is anyone that has shortness of breath or chest pain to make sure that they seek health care very quickly.
That's great. Now we have another interesting question from Andrew Maki, or Fanibu, and I apologize if I got your name incorrectly. Is there any chance we'll have tests available in a mass way so that people don't have to wait for hospital testing? I think you're referring to point-of-care tests that can be done very quickly.
Yeah. So thank you, Andrew. That's a good question. So right from the start of this outbreak, we've been working very hard. The whole global community has been working very hard to have tests available. And these are called Pcr tests. These are molecular-based tests, which basically you take a swab, a sample from some of your upper respiratory passages in your nose and a little bit further down your throat, to be able to quickly determine if you have COVID-19 or if you have something else. Very quickly, within a week of identifying this outbreak, this cluster of pneumonia in China, Chinese authorities shared a sequence. And that's the RNA, that's the blueprint of what this virus is. And by doing so, they were able to help the entire world, including China, but other countries as well, develop these tests so that you can actually determine if someone is infected. It usually takes, it depends on where you are in the world, but it usually takes a matter of hours to maybe a day to get your results back. And so in some situations, that's just too long. So we're working very hard to make sure that we have what's called a point of care test, or a bedside test, so that you can have a really rapid, within minutes, test result. We're not quite there yet, but there are a lot of virologists and laboratorians who are working hard to make sure that those tests are done quicker.
Thank you. That's really good news. Darren Kay wants to know if COVID-19 is airborne.
So Darren, so thank you, Darren, for that question. So no, COVID-19 is not airborne. COVID-19 transmits via droplets, and what we mean are these small little particles of moisture, liquid. And these particles, when they come out of your mouth, they drop. And so that's why we say between 1 and 2 meters. Anything beyond that, and they don't disperse. So no, it's not airborne. But the one thing I should say is that in healthcare facilities, what we tell our healthcare workers, and I just want to say how grateful we are to all of the healthcare workers who are working to treat patients, particularly in China, but not just in China. We know you're on the front lines, and we're very grateful for all of the hard work that you are doing. We do tell healthcare workers that when they are treating patients, sometimes they have to do procedures on very sick patients where they have to intubate them. And sometimes you have particles that can be dispersed much further than just that 1 to 2 meters. And so in those situations, we tell healthcare workers, you have to use airborne precautions. And so there may be some confusion out there when we say airborne precautions. Those are for healthcare workers performing very specific procedures, but for every day, no.
Great. The next question is there any association between the flu and between this COVID virus?
So that's a very good question too. I get that question quite a lot. So COVID-19 is not influenza. It is a respiratory virus, and so it's very difficult to determine in the early stages of illness of whether or not you have flu, or if you have COVID-19, or if you have another respiratory pathogen that's circulating around. But it is not flu. And the reason we know this is because we know it transmits a little bit differently in terms of who is most affected, who has a higher risk of being infected. It's a very serious disease, as flu is. And so for COVID-19, the majority of people, about 80% of people who get infected with COVID-19 will have a mild disease and will recover. But there is about 20% of people that will go on to develop severe disease and will require some advanced care in a hospital. But like I said, I've just come back from China, and what we learned there, one of the really most important things that we learned there is that many people who have had severe disease are now going on to recover. So it doesn't mean that if you have a severe disease that you will die. It means that you will get the right care in a healthcare facility, and you have a good chance of survival. So that is very good news.
And would you say that people who get severe disease start with what looks like a mild disease become ill, so getting to care early will help them?
Yes, and we do know, yes, so when you are infected, you do start out with a mild disease. What we look for are what we call risk factors for severe disease. And what that means is that are there certain individuals that have maybe some underlying medical conditions, or who are maybe of older age, that have a higher risk of developing severe disease. And we know that people who are over 60, people who have underlying disease like cardiovascular disease or an underlying respiratory or chronic respiratory disease, diabetes, they have a higher risk of having a severe disease.
Okay, we've got another question that I have certainly seen come up in all sorts of places from Casey Carmichael, who asks, can virus particles survive inside packages?
So that's a very good question. We've seen that a lot, and we actually have that on our Mythbusters, which is on our website, which is trying to address some questions that many people have. So there are some studies that are ongoing right now that look at virus survival. And so what that means is how long can you actually detect a live virus on a surface, and for how long? And so these are some preliminary studies. We don't have the full results yet, but what we know from other coronaviruses like SARS and like MERS is that on packages, on certain like cardboard materials, that it doesn't last very long. And so it won't stay viable. It won't be alive. The virus won't be alive for a very long period of time. What is important, though, on certain other surfaces like plastic or like in healthcare facilities, that the virus can be inactivated or killed, if you will, by disinfectants. And so, as I'm sure everyone has seen, when you clean your house, you clean in healthcare facilities, it will inactivate the virus.
And you're talking about any kind of disinfectant?
Normally ones with bleach. So in our guidance materials, we have some details on what that actually means. How many parts bleach versus how many parts water. But yes, some bleach would be good.
So if you want to know more about disinfecting your surfaces, go to the WHO site, go in and look at the guidance, and you'll find it under coronavirus, and you'll find all that information there. Now, Sarah Lubitsch asks, how can individuals find out if there are cases near them?
So Sarah, that's an interesting question. So there, I've seen, I don't really actually know a good answer to that. What I can say is that I have seen in some countries, they use a lot of data, big data, and they have ways in which you can see on a map if there are cases nearby you. I haven't seen that here in Switzerland, where we're based, but I have seen that in some other countries. But I think if you're concerned, like I said, educate yourself about what is happening around you. Watch the news, talk to your parents, talk to loved ones, talk to your healthcare provider. If you have some concerns, make sure that you address those concerns and you get some good answers. And there's a lot of good information online, but there's also a lot of bad information online. So make sure you check the WHO website, and you can see we have situation reports that we put up every single day, and so you can see the latest information that we have.
And correct me if I'm wrong, but even if you have, say, somebody in the next house who's ill with coronavirus, if you're doing all the sensible things to protect yourself, if you're washing your hands, cleaning your surfaces, you're going to be all right.
Yes, that's right. That's right. It's not in the air, circulating around like that. And I think if I could just take this opportunity to say, in the last few weeks, what I've seen in China is this overwhelming involvement of the community. Everyone is involved in this fight against coronavirus, and that is really powerful. So I want everyone watching this to know that you can do something about this. What we mentioned in the beginning of washing your hands, sneezing into your elbow, educating yourself. You can take control, and make sure that you protect yourself and you protect your families. And everyone in China is really working towards fighting this disease, and that is really a wonderful thing.
And there's another interesting question here from Nurayaki Agus. If we've already got influenza vaccination, will that protect us from coronavirus?
That's a good question. So unfortunately, an influenza virus will not protect you against COVID-19, but an influenza virus will protect you against influenza. So that is very important. There are vaccines that are in development right now for COVID-19 and for coronaviruses. And these coronavirus vaccines have been in development actually for many years, starting with SARS, which is severe acute respiratory coronavirus, and MERS, which is Middle East respiratory syndrome coronavirus. Now, what scientists are doing is that they're taking the work that they've done for those pathogens and trying to use that to build vaccines for COVID-19. So they're in development, they're not ready yet, but we are working very hard with many partners to try to push that and make that happen a lot quicker.
And so then we have another interesting question about treatment from Louise Vaughan Harry. She asks, if a person contracts COVID-19 and then it goes to pneumonia, will they be treated with antibiotics or will they be treated differently because of the viral pneumonia?
So that's a good question. So as I mentioned, the majority of people who are infected with COVID-19 will have a mild disease, which may actually include a mild form of pneumonia. And so normally you're treated based on your symptoms coming in. Antibiotics will not work against COVID-19 because that's a virus, but I know that you could have a co-infection with a bacteria, and an antibiotic may be helpful for that, but it won't actually work against the virus. Antibiotics don't work against viruses, unfortunately.
So we've got another question which is interesting. It's a little bit about testing, as you've explained, but Carolina Gomez wants to know what's the procedure for detecting whether somebody's got coronavirus. What do we need to know?
So the first thing is about what you can do. And so WHO recommends that if you're feeling unwell, just in general, you stay home for a few days. But if you have symptoms that have fever and have a shortness of breath in particular, make sure that you go seek health care early. And in that case, you would talk with your healthcare provider and you would tell them what you've been doing, tell them how you're feeling, and they will ask you some questions. And they will probably ask you where you've been in the last 14 days. And so if you've been recently to an area where there is COVID-19 transmission, I think it's important to say that COVID-19 is not everywhere in the world. It's in certain places right now. It's in China. We have seen some cases in Italy and in Iran and in other locations in Korea and Japan, but it's not everywhere. And so your healthcare provider will likely ask you, where have you been? And then they'll take a sample. And it's usually like a long Q-tip, and you're a doctor. You get a long Q-tip, and they'll it's a little uncomfortable, but it's not painful. It's not painful, and they'll take a sample, and then they'll do a test to see if you have COVID-19.
And that test, as you said, might take a while because they have to do, it's a quite complex test in the laboratory.
In the laboratory,
but
yes.
You'll know within about 24, 48 hours.
I believe that's the typical time frame, yes.
But normally, again, if we're concerned that somebody has COVID, they will probably be asked to stay in the hospital in isolation at that point.
If you're positive, yes, then you will be, I'm sure, admitted for care and making sure that, we give you the best care that we can.
Sergeant Ali asked an interesting question. He wants to know whether there are reinfections. Do people get reinfected? Have we seen?
Ooh, that's a very good question. I'm not aware of people being reinfected with COVID-19. What we know is that people who develop this disease, they will be sick for some time, but for a matter of weeks. But then when they recover, I have not heard of anyone being reinfected with COVID-19, but we have to remember this is very early days of this outbreak. This outbreak was detected on December 31st, and we're 7 weeks, or I don't even know what even the day is today, but it's 7 weeks, it's very quick. So there's a lot of knowledge that we're accumulating every single day. And so that is one of the questions that we have, and we will be looking for answers towards that in the coming weeks.
So, and we'll be appearing every day, so you'll be able to find out more. We've got the big question I've heard many times comes from Joy Flores Corpus. What about asymptomatic transmission? Is this occurring?
This is also a very good question. So what we know about people who are infected with this virus, as I mentioned, most people will have mild disease, some people will have severe disease, and some people will die. There are individuals who have very, very mild disease, and some of them will shed virus, which means that they can transmit to other people. We are aware of case reports of some individuals, a small proportion of individuals, who are, I wouldn't even say asymptomatic, but pre-symptomatic, meaning it's a few days before they develop symptoms themselves. And many times when we go back and we talk to them, we find out that they truly weren't asymptomatic, which means no symptoms at all. And so when you go back and you interview them, oftentimes they say, well, actually I wasn't feeling very well. So it's this pre-symptomatic phase or mildly symptomatic phase. Having said that, it is possible, and we do have some case reports of truly asymptomatic people that can infect, but we don't believe that they play a major role in transmission. We believe that people who are symptomatic are the ones that are transmitting the virus to others.
So it's rare but possible.
It's rare but possible. It's very rare, yes.
And
not a major driver of transmission, which is a fancy way of saying we don't believe that they're the people who are most important in transmission.
And importantly, they're not the people to fear either.
Right.
And when you mention pre-symptomatic, you mean really in the early stage, maybe the first symptoms that are just feeling like a train. She's feeling exhausted and aching, but wondering if she just overdid it the night before.
Right. That's right. Yeah, that's right.
So we've got a few questions about temperature now. Casey again, but it's a good question, so you get another question, Casey Carmichael. What will it do in warmer temperatures versus colder temperatures?
What will the virus do in warmer temperatures versus colder temperatures? Well, we are learning about what this virus can do in different countries. And so I think again, this is one of the good questions that we're starting to accumulate some knowledge of. You know, there's a lot of cases in China. You know, I don't know the percentage today of how many cases are in China compared to the rest of the world, but it's the vast majority still. And there's some colder climates there. I was in Beijing recently, but I was also in Guangzhou, which is more southern part of the country, which was much warmer. And so you do see transmission. It's too early to say if temperature, in terms of outside temperature, has anything to do with virus circulation. But we need to prepare ourselves that this virus can transmit between people anywhere that it goes. And so you need to be ready, and you need to make sure, again, I'm going to say again, that you wash your hands regularly with soap and water, and make sure that you wash thoroughly, or you use an alcohol-based rub. You make sure that you practice respiratory etiquette, where you sneeze into your elbow or cough into a tissue and throw that away, and make sure you keep yourself educated. Know what's going on in your area, so that you can better protect yourself and your family.
And on that, yes, we're getting quite a few questions about traveling. What should you do when traveling? Kiara Mayoni says, should we wear a mask when traveling? She mentions that she knows that this only helps people already infected not to spread it, but does it help preventing it?
So there's a lot of things that you can do to protect yourself while traveling that have to do with COVID-19, but have nothing to do with COVID-19, and that is making sure that you travel when you're well, you know, you're feeling well, you and your family, making sure, again, you wash your hands a lot, you practice respiratory hygiene, making sure that when you eat food, you know, you're eating cooked food, or that you wash food, making sure that it's washed before you consume them. We recommend wearing a mask when you yourself are ill. And so just wearing a mask in general, no, but making sure that if you're having symptoms, respiratory symptoms, that you wear a mask.
And we have another interesting question from Kia from Ethiopia. How many, what's the rate of infection in children? Are many children infected?
So hi Kia, that's a great question, and one of the big concerns of many that we have about COVID-19. There was a really big report that came out of China, I think it was last week, where it was looking at 55,000 cases that had occurred in China, and very few were among children. I think it was 2% of those infected were among children, and that's a very low number. And that's important, you know, because in flu, for example, children are really important in transmitting this virus, but in COVID-19, they don't seem to be. We don't know why yet, and so that's a big point of research and to help with our understanding of what that actually means. But even the children who are infected, many of them will have mild disease.
Okay, well that's reassuring. Another question that we've certainly had before, and I know we've on our list after science, and it's an important one. Can it be passed on from pets and also from chickens? Marilyn tries to ask.
So I'm not aware of any evidence that this virus transmits between pets and people, and people are looking. And so there's a lot of investigations that are underway. They have not found this virus in an animal yet. In the zoonotic source of what we believe initially that this outbreak began with people who were in contact with wild animals, not pets. But we have no evidence of this virus in pets, and no evidence of this virus transmitting between pets and people.
And what about chickens?
Or
chickens are pets too.
Chickens are pets too, or chickens. So yes.
Okay. A lot of people are asking about treatments. Have we got any treatments? We know we're doing a lot of studies, but have we seen any medicines that seem to be helping people recover more quickly?
So as you just mentioned, there's a lot of studies that are underway, and so when we have an outbreak like this, it's really important that these studies are done the right way, and we call these clinical trials. And they have to be done in a way that we look at the appropriate use of that treatment compared to some others. And we don't have results from those yet. But in China, there's more than 100 clinical trials that are ongoing. Some are using Western medicine and some are using traditional Chinese medicine. So we were just in China and we were asking about these questions. And so we know of a number of questions that are being investigated in patients, with patient consent, of course. But we don't have results of those yet. So hopefully very soon we will have some results that we can share.
Here's an interesting question from Praveen Ganapati. What about swimming pools? What would be the best, Praveen asked two questions, but we've already talked about bleach-based cleaning agents. Praveen asked about that, but he also asked, what about using swimming pools?
That's a very interesting question. I think you can use swimming pools just fine. Many swimming pools have chlorine in them. And we haven't heard of any transmission happening in swimming pools that I'm aware of. And that's a good question, but I'm not aware of any transmission happening with relation to swimming pools.
And it is happening in places where there would be swimming pools.
Yes, of course. So a lot of these types of questions, these are really good questions that you're asking, so thank you for sending them in. We try to get answers to those through what we call epidemiologic studies. And what we look at is we talk to patients, we talk to people who are infected and people who are not infected. And we say, what did you do? And ask the same questions to the people who are not infected. And through those types of investigations, we learn what are called risk factors for infection. And so what we look for are travel history, what types of jobs you may have, what types of exposures you may have had in the 14 days before you got sick. So those are the types of risk factors that we would look for, but swimming pools are not one of them.
Okay. And in fact, it's probably good to ask what are the risk factors you're finding? And
so no, not yet. So what we're looking at right now, the risk factors for severe disease we know are these underlying medical conditions that I mentioned earlier. So the cardiovascular disease, diabetes, underlying chronic respiratory diseases, older age, those put you at risk for developing severe disease.
And now we've got an interesting one from Khaled El Habib. Should we stop our kids from going to school?
That's a very good question, and as a mom of two myself, I can understand where that question is coming from. So it depends on where you live. Right now, a lot of the schools in China are closed right now after the holidays, after the Chinese New Year and the Spring Festival. And some of those schools are going to be opening again soon. And here, where we don't have transmission, it's perfectly safe to send your children to school. Yeah.
And here's another question. I'm not quite sure who it's from, I'm sorry, but what action should we take if a working colleague has a fever and is coughing, but refuses to seek medical attention and continues working?
Well, the first thing to do is talk to your colleague and just ask them how they're doing. Have a conversation. Just because you have a fever and a cough doesn't mean that you're infected with COVID-19. That's really important. It's also flu season. So there's a lot of people around who have the sniffles, who have a cough, who have a fever. Talk to your colleagues. Find out how you can help them. And what's important is that they seek medical care, especially if they have chest pain, if they have difficulty breathing. And then the doctor will ask them, where have you been in the last 14 days? And that will trigger maybe or not they get a test for this COVID-19.
And at this time, do you think people should be having conversations with their employers about if an outbreak occurs, where they are, can they work from home? Are there other ways in which they can work while not necessarily being in the office?
Yeah, that's a good idea. I mean, just having conversations with your families, express your concerns, talk to your employers, and just see what your plans are. It's very important, and we talk to everyone in the world about getting ready. What would you need to do if this virus were to show up? How can you make sure that you continue to be able to work? And there's a lot of ways in which you can work from home, if that's possible with your type of job. So talk to your families, express your concerns, don't hide them in, because there's a lot of good information that is out there that can help educate you on what this is, and even more importantly, what it isn't. Yeah.
And on that, again, a lot of people have young children, so we're seeing quite a lot of school closures, and people then have to stay home because they have to look after their children. So again, this is something you would recommend discuss with your employers now. What are you going to do?
Yes. And this is a conversation that needs to continue to happen. As I mentioned earlier, this situation, this outbreak is evolving very quickly. We're learning all the time new things about this. Please come back to the WHO website and look at what we have posted. There's new postings every day, whether there are situation reports, which gives you an overview of the latest cases and what WHO is doing. There are myth busters, there are videos that can help you, teach you about, like I said, how to wash your hands, how to make sure you wear masks appropriately, and many other things. So please do continually, read about this and look at the websites and make sure you have the latest information at hand.
Now, as Diana wants to know the question that many want to understand is, how can you tell the difference between just a common cold and the coronavirus?
So in the early stages, you can't. In the early stages, it's very difficult. But what we say is if you're in an area where this virus is circulating, it's important to either call your medical facility if you're just feeling generally unwell. But as I mentioned, if you do advance to having shortness of breath, make sure that you seek health care immediately and say what you've done, say where you've traveled. And then the only way to distinguish is through a test. Yeah.
I just want to say, I can't believe people are watching us from all around the world. We've got people from Angola, UK, Vietnam, Peru, Indonesia. The list is so long. I'm
Wonderful.
So glad and excited, but that's what we're here for, to share information and to answer your questions. And I've got another interesting question. Can it spread through drinking water?
Not that I'm aware of. No, it cannot spread through drinking water. As it spreads through close contact and through droplet, as I mentioned earlier, but not through drinking water, no.
And it's a repeat of an earlier question, but I think there's clearly a lot of concern, because I've seen a lot of questions about touching surfaces. People are worried about touching paper, plastic and cardboard surfaces, and this viewer asks, do you recommend wearing gloves?
So if you touch many surfaces all the time, all day, and so what is important is that you are able to do that, but that you make sure you wash your hands. So you washing your hands with soap and water will remove any stress that you have there. Just make sure that you wash thoroughly or use an alcohol-based rub.
And it's a kind of related question. Can it be transmitted by aerosol transmission by flushing the toilet? I think the questioner remembers the SARS incident in Hong Kong where this occurred.
So, no, not that, no. What would be good to do is if you close the lid before you flush the toilet to make sure that nothing spreads that way, but not necessarily the virus, and making sure that you close that lid and flush the toilet before you go out.
Okay, we've got many, many more questions, but we've run out of time. So we're going to keep on repeating and you will be there.
All right, so this one, sorry for that long video, guys. This one is the Manitoulin Island Network Care Provider poster. So Mary Jo had alluded earlier to the collaborative group, which is comprised of the family health teams, as well as Chiking First Nation, Wiki Health Centre. And this is what we've agreed upon in terms of what the messaging is across the board, that we want to be consistent. So we ask you the question, stop. Do you have a fever, cough, or difficulty breathing? Which are the symptoms? Have you traveled out of country in the last 14 days? So you might also hear that on the screening. And have you been in contact with a sick traveler in the last 14 days? If you answer yes to any of those questions, we ask that you call your healthcare provider. So if you ended up coming to the health center, we would connect you with one of the doctors or nurse practitioners who are on call or on that day, and they would probably speak to you to find out more about your history, find out about your travel history, where you've been, how bad your symptoms are, if you're mild or severe. If you turn out to be severe, they will, they've agreed to do home visits, to do a nasopharyngeal swab, and they are prepared to do so. And if you have severe symptoms, like trouble breathing, chest pain, rapid breathing if you're an infant, where they're breathing very, very quickly and they're having really lots of trouble breathing, and you meet any of that criteria, we tell you to call 911, and they'll ask you the same questions. So focus on what you can do. Wash your hands. Remember to cover your cough and your sneezing to prevent those droplets that she was discussing in those videos from traveling. When you're sneezing, use your elbow. So do the dab. Do not touch your T-zone, so your eyes, your nose, and your mouth. Get your flu shot to protect yourself against the flu. Clean high-touch surfaces in your home. And practice self-care, so take care of yourself. So some high-touch surfaces in your home. Doorknobs, the refrigerator door, the remote control, video controllers, your tablets, your telephone, your cell phone, countertops, toys, the microwave, light switches, faucets, toilet flush handles, the teapot handle. We all know you got teapots on your stove. Stove tops, the switches, buttons or knobs, and railings. So the World Health Organization recommended cleaners, which you heard in the video, are bleach-based products. So the research shows 5,000 parts per million for disinfecting surfaces. Not cleaning, disinfecting. The other one's alcohol. How do you make this cleaner or disinfectant at home? So 100 mils of bleach to 1,000 mils of water, considered a high-level disinfection. A bleach and water solution should be mixed daily to preserve its strength. And for high-level disinfection, they recommend a two-step process. So you would clean the surface first, and then you would dry it. And for disinfecting, you would leave it on the surface for 10 minutes for the contact time. What I need to consider if I decide to use bleach disinfectant made at home. So for example, a 10-minute contact time with a higher strength of 1 to 10 solution that contains the 5,000 parts per million. The surface should be rinsed with clean water to remove the bleach residue. This helps to minimize surface damage and is especially important when using bleach to disinfect toys and food contact surfaces. So the next video is featuring our lovely community health nurse, Julie Sinaway. She's going to show you a proper hand washing video.
Nurse here at the Wikwemikong Health Centre. As you know, we are in the heart of cough, cold, and flu season. Today I want to do a demonstration with you on hand washing. Why? Because hand washing is the #1 way to reduce the risk of spreading germs. As you know, on a day-to-day basis, our hands come into contact with so many different germs, bacteria, and viruses, mainly because of the things that we touch. So this could be doorknobs, it can be our cell phones, tablets, desktops, keyboards, pens, pencils, money, pretty well anything that you can think of. And remember, germs are microscopic. They cannot be seen with the human eye. So we're going to be using a product that closely represents what germs and bacteria may be looking like on our hands. And we have an ultraviolet light here. So we're just going to go ahead and turn off the lights and see what my hands look like right now. Okay, so we're taking a look at my hands. And as you can see, there's lots of little white specks. Okay, and these are like what the germs and bacteria are looking like on our hands. Pretty gross, right? Okay, and now I'm going to show you how to wash your hands. So the first step is we want to turn on the tap, and then we're going to apply warm water to our hands. Next, we're going to apply soap. Here's the really important part. We're going to want to lather for
20 seconds. So we're gonna go palm to palm lathering. We're also gonna go in between our fingers. Okay, we're gonna do the back of our hands, each side. And sometimes we kind of forget, it's important to do our fingertips and our fingernails. Okay, so make sure we're doing all of that on each hand, and don't forget our thumbs. Okay, then we're going to rinse thoroughly with water, ensuring that we get all of the soap off. We can also use our hands to assist us in this. Still a little fuzzy. Okay. Then we're going to grab a paper towel or a clean towel and dry off our hands. Okay, ensuring that we're putting the paper towel in the garbage and using the paper towels to turn off any taps that we have, either at the workplace or at home or at school, wherever you are. Okay. Nice and dry, taps off, in the garbage. Okay, so now we're gonna go back and look under the ultraviolet light and see what my hands look like. Okay, so we're just gonna turn the lights off. Okay, and let's take a look. There we have it, folks. Nice, clean, safe hands. Be sure to follow our page and watch for more tips on hand hygiene, such as when to wash your hands and how often, when to use soap and water versus an alcohol-based cleaner, and more tips on proper hand hygiene and reducing your risk. Thank you. Bye.
Stop the spread of germs that can make you and others sick. Cover your nose and mouth with a tissue when you cough or sneeze. If you don't have a tissue, use your elbow. Wash hands often, especially after coughing or sneezing into a tissue.
So this next one is a really long video about hands off the T-zone and what exactly the T-zone is.
Welcome everyone, Dr. Mandel here. My mission is to share this information with the world to keep ourselves healthy, to prevent sickness and disease, and to prevent us from touching our faces when we may not even realize it. If you haven't subscribed, please do so. And hit that bell to get all future notifications for my upcoming videos to help you and your family. There's no doubt that all of us are guilty when it comes to touching our face. This is a serious problem. The issue here is that we don't realize or even think about where our hands were before then. So do yourself a favor. Just think back the last few hours where you did. Maybe on the subway, holding on to the handrails, opening up a door, sitting down at a restaurant, touching the menu, being on the keyboard, shaking hands. The list can go on indefinitely. But the bottom line is, we are touching germs, viruses, bacteria, and other pathogens. The only way that these pathogens that we're touching will get us sick is that if we bring it up to our facial area. I call it the T-zone. If you look at the eyes going across, down the nose, into the mouth, that T is where all our problems start. The average person will touch their face a minimum of 3 times an hour. And a student sitting in class will touch their face an average of 23 times an hour, putting their hand on their chin, their face, as they're looking up at their instructors. So what about that itch on our nose or our eyebrows? Combing your hair, putting on your glasses, putting on your contacts. Just unconsciously always touching our face and not realizing the harm that we're doing to ourselves. Now this T-zone, the eyes, the nose, and mouth, this is our critical area. This is where all pathogens seem to make their way into our bodily system. But what if you're touching your forehead or your cheek? You may not think so much of it, but what about when you sweat? That sweat can make its way into those areas. Or what about the millions of people worldwide who live in cold or dry climates? Your chapped lips, the dryness of your lips, pain, touch, neck pain, touch. We instinctively will touch the areas that bother us. And what about those people who are nervous, anxious, fidgety, have no patience? They're always touching their face. You need to be very aware of this. My best advice to you is this, is to make sure you're keeping a box or some tissues on you at all times. When you feel that urge to scratch an itch, rub your nose, adjust your glasses, grab that tissue. Use that instead of your fingers. And if you have to sneeze and you don't have a tissue handy, get into the habit of sneezing into the elbow, into your arm region, rather than sneezing outwards or using your hand and possibly contaminating someone else. Now, breaking habits can be very difficult when it comes to touching your face. Now, for those people wearing contact lenses, consider wearing glasses a little bit more. This will discourage you from rubbing your eyes, particularly if they're dry. This will help prevent any virus transmission into your body. You might want to try using those Post-it notes, making little notes, putting them on your computer, on your bed, in your bathroom, in your kitchen, just to keep reminding yourself not to touch your face. Doing this over 3 weeks will change those bad habits. Now, one of the best things that you can do is to keep your hands occupied. Use your hands doing different things. That will minimize those triggers from you touching your face. And this would be a great time for you to start cleaning and sanitizing those hard surfaces within your house. Now, I understand that when you have that itch, it drives you crazy. You just want to grab it and scratch it and get rid of it. The best thing to do is to use a tissue. But most people don't carry tissues on them all the time. If you can stick it out, that's also a wise idea, because that itch would go away. But if you can't, use your shirt. Do not use your hand. So try to be aware of those triggers. Having that self-awareness does take practice. But within a short period of time, you will start seeing great progress. And if you have that worrying personality, and you notice that you have lots of anxiety or you're nervous, try to deal with the cause of that issue, because those conditions will make you touch your face much more often. The best thing that you can do is to wash your hands. When you're touching any kind of foreign object, get into the habit of doing this immediately. You want to start by wetting your hands with clean running water. It can be warm or cold. Once your hands are wet, introduce soap into the equation. Washing with soap is far more effective than just rinsing your hands with water alone. Lather your hands with soap. Take the time to generate suds between your fingers, the back of the hands, and under your nails. Once you've lathered up, scrub your hands for at least 20 seconds. Now, 20 seconds should be considered a minimum, and most people rarely ever reach the 10-second mark. Then rinse your hands under clean running water to remove the dirt and germs. Now dry your hands, using a paper or clean towel. The CDC says that germs can be transferred more easily to and from wet hands. So don't scrub them for 20 seconds and start touching things with sopping wet fingers. So the next best thing would be having a good hand sanitizer, a minimum of 60% alcohol. And when you use your hand sanitizer, put a generous amount on your hands and continue to rub them together, all sides, until it's dry. So we need to prevent these ugly little critters, these viruses and pathogens, from entering our body, trying to take us down. By following these rules and understanding more about our bodies, preventing our hands from touching our face, we're going to persevere. Please share this video with your friends and family. Leave your comments below. And most important, make it a great day.
So just some generic recap, quick tips: wash your hands often, cover your mouth and nose when you cough or sneeze, get vaccinated, get that flu shot if you haven't gotten it already, don't touch your face just like you said, and stay home when you're feeling sick, and clean and disinfect all those high-touch surfaces. So if you think you have COVID-19, COVID-19 has been added to the reportable cases list, and so all cases need to be looked into and discussed with your healthcare provider. This means that if you think you have it, you should self-isolate yourself and speak to your healthcare provider right away to discuss your symptoms. We are encouraging you to contact your doctor or nurse practitioner's office, or you can call the health center, to speak with your provider about your symptoms if you think you may have it, if you've traveled out of the country in the last 14 days, or you've been in contact with someone who's had COVID and you're showing symptoms. If you have trouble breathing, difficulty breathing, rapid breathing, or shortness of breath, please seek immediate medical attention and call 911. So these are some self-isolation documents for clients and caregivers, which you'll see in the packages that Tia has over there. Some information on how to self-isolate. And self-isolation guides for caregivers, household members, and close contacts. And it's, again, the same reiteration of the same thing. One is more like words and the other one is just infographics, so nice little pictures and brief bullet points. And that's it. I guess I'll open it up. Mary Jo.
Thank you, Teresa. It's important to repeat what we need to do to ensure our health, and we're protecting not only ourselves but our family members. So by going through all the Q&A from the World Health Organization, I think that was, again, just a good reminder of some of those questions that you probably already had, and maybe you were coming here to ask those specific questions. And some of what Teresa also presented was just a reminder of back to what we need to do as individuals and what we are doing in terms of supporting one another. So just a little bit also, what I forgot to mention was that when we were looking at doing the, calling our emergency control group together today, we did talk about that communication piece. So we're fortunate that we now have 3 members within respective organizations that are in that communication role. So we have Carrie Sinaway with Wikwemikong Health Centre, and everybody knows Carrie, I think. We have Mandy Richard, she's with Wikwemikong Territory Administration. I'm not sure if she's still here, but she's new to her role. And we also have Dwayne Onamikwam, he's with education and he does the communication piece there. And then we have Sandra, who liaisons with GIMA for the communication. So we have more members now that can work together to help us get this message and to keep the community informed. So we're fortunate to have that. So they're going to be working closely with our emergency control group in ensuring those messages that we want to get to the community as they become available. So I'm going to
You're doing fine. So we did bring other departments in, and I'm going to pass it over to our tribal police chief, Terry McCaffrey, to also provide some comments in respect to the police.
Thank you, Gima. I wanted to, I have a really long video to share, but I think you want to see it. I'm just kidding. What I do want to share is that WTPS is very prepared to address these type of situations. We do a lot of preparation to ensure that our officers and staff are able to provide safety and security for our community, no matter what comes our way. Now, that being said, we are taking a supportive role here, and we're working closely with our local chief and council, and also with the public health department, who, by the way, are doing a fantastic job at addressing any of these concerns. Now, that being said, it's very important that we continue to educate ourselves. So I kind of jested at the video length, but the information that's being provided in this video is key to us staying safe, to keeping our families healthy, and to ensuring that we maintain our own health, and that we also reduce fear in the community. There are a lot of false messages that are being portrayed out there in social media and other medias that are wherever you might be looking. We need to stay rooted in credible information like we're getting here tonight, and ensure that we share that information with all of our family and friends, and that we reduce fear. Because as long as we are prepared, then as a community, we will be much stronger. So that being said, I'm very confident that we as a police service are prepared to be able to provide safety and security through all of this. I don't want to take up much more of your time, because I feel that all the messages that have been already portrayed from Yuma, from our public health individuals, have really said it all. Before I drop the mic, I'll just say, wash your hands.
And I'd like to ask the Cheryl to come up from the nursing home to provide a little update on what the nursing home is doing in response to this.
You told me I was closing the show. So, as we've heard tonight, like the elderly population is the most at risk. So at the nursing home, we're taking some preventative measures. So we have the same sign that they had showed there. We have that posted in the front. So anybody that's exhibiting any of those symptoms are not to enter the facility. If they are not showing any symptoms, they do come in. They do have to go through a screening with the front office just to make sure, asking some questions just to screen out possibility if they're a carrier. The same thing goes to any vendors, deliveries. They have to go through that same screening process. As soon as they are screened, they have to, they will receive a visitor pad, and then that way all staff know that the visitors have been screened, so they don't kick them out. Any activities that we had planned that would involve the public have been canceled. But we will still be having activities for the residents, but it's just going to be in-house, so the public won't be invited. Because we did originally have a dance scheduled for this Saturday, but so that's just going to be for the residents only. Any residents that are being admitted, or any residents that went on an LOA, will have to be subject to that same questionnaire as well too, that screening process, just to make sure that they're not bringing that virus in. Hand wash stations are set up, and increased disinfecting protocol is in place. Some family members were given the code to the nursing home. It was just so that they weren't standing and waiting for somebody to open the door. We've since changed the code so the family members won't be able to come in and go because we really need to screen and we need to know who's coming into the home. And I would just urge, like, if you're not feeling well or if you think you might have come into contact, please do not come to the nursing home because they are the most vulnerable population and we're trying to protect them. And I seen something written on Facebook and I had shared it and I thought it was relevant. I see a lot of people like saying, I would survive the coronavirus, I'm taking my chances. The way I see it, yeah, I'd survive it, but I might carry it to someone who wouldn't, and that, folks, is the problem. So if you think you might come into contact with it, don't come to the nursing home because we need to protect them.
Our long-term care manager, Yvette Porter, has some words on.
Hi everyone. I just wanted to give you an update of what we're doing for the home care program. Currently the PSWs and the nurses screen everyone before they go into the home. We're also screening any vendors or any contractors that come into our building. Even looking at screening seniors when they go to Amiclook and ensuring that we have all the hand sanitizers at the center. We're not quite ready to cancel anything yet, but you never know. Everything, it's always changing. So for now, we're going to continue with activities, but just ensure that people that are coming into the center, that they are screened. And that's it.
And we have some comments from Judy Black.
So I just want to let everybody know that there's very little research information about women that may have COVID-19 and are breastfeeding. And this is always the question about breastfeeding. But right now, the best that we know is that if a mom was sick, she would need to wear a mask and gloves at all times when she would be taking care of her baby, and she is still to continue breastfeeding. So those are the precautions for mom and baby. If you're pregnant, all routines stay the same. You visit your healthcare provider, and your plans for where you are going to be delivering your baby are all the same. The only thing that you would need to inform is that you actually do feel that you have symptoms, and then under the direction of your doctor, again, wearing masks, and the healthcare providers themselves would be wearing their PPE when they would be caring for you. Thank you.
And we do have our education staff here, Mr. Stark, and to provide some info on what the education's approach is.
Thank you, Joe. Next third business cards, Yazga week to get for the WBE, which is the system principal, and my job is to support all the principals in the academic programming for the board. I want to send I talked to my director. I want to send her regrets she couldn't be here today, but she is in constant touch with us, and we continue to feed her information that we gather as well. I also want to just quickly thank, I've been in multiple meetings this week, and between Mary Jo and Teresa, they really take a leadership role at those meetings, and they're very well informed. And so Chimigwich, and we don't always see them, but behind the scenes, Shanna and Marilyn Jocko are the ones who keep us all together, get us meeting, feed us information, and update us on emergency plans and contacts. So a lot of pieces behind that you might not see, but it's a real team effort. My biggest learning this week was that decisions aren't made like drastically or too quick. It's big decisions come from the emergency control group. And that's a group that's been identified in emergency planning, about 11 people, and that's headed by Ogama. So when people are throwing questions to us about the school, or you've seen things like the province is closing, we'll take these things seriously, but we're going to take our time, and we have time. March break is coming, and we'll make a very informed decision. And what I've also learned is that, and it's really awesome, the communication team. So instead of you hearing something from the school through Dwayne or just through the band, Carrie, Mandy, and Dwayne are in close contact, and so when we release information, it's well thought out, and it's going to be a coherent message. And what I really appreciate today, both Mandy and Carrie talked about, is that they're really looking closely at the sources of information. So if people are saying, well, I saw on Facebook, or so-and-so says, when they're releasing information, they really research it and they're reliable sources. So as you're looking for information about school or the community, follow Carrie, Mandy, and Dwayne. If we end up closing for a little bit of time, we're already thinking and planning that. So I spent some time with our IT manager, Josie Tolper. If Tolper doesn't ring a bell, that's Maureen's sister, Josie. But she's really outlining all the digital resources that we have. So even if a decision is to close for a while, we're looking at virtual options through the platforms the kids are already using in school, as well as Dwayne's got a YouTube channel, so that we can maybe have our teachers continue learning or sharing learning or providing guidance to parents at home to keep learning going if we're closed for a little while. And then when we're in operations as well, under Maureen, she's my counterpart at the board office, Maureen Avens, and she oversees the maintenance team. And she works with Tim, and they have a real comprehensive plan where they'll be wiping surfaces on regularly scheduled times, cleaning washrooms like high traffic areas, and he knows all the concentrations of the cleaning chemicals and bleaches and all that. So there's a real solid plan to keep the schools very well sanitized. And then what we will be doing as well is we will be very careful and probably limiting outside people coming into the school, like presenters and things like that, until we know that everything is a little safer and calmed down. So again, Chicken Witch for asking me to be here, and we know we're in good hands with this guy to my left too, so miigwech.
So some of the, one of the questions that we had earlier today was, how long does testing, or what's the process for testing? So currently, you have to be experiencing symptoms before the doctor will be ordering a test. And if they order the test, currently it gets sent down to Toronto to the provincial lab, and it's anywhere from 24 to 48 hours before they'll give the results back to the doctor. So it's not, you're not going to find out immediately. And depending on the severity of your symptoms, they may ask you to return home and isolate yourself. Or if it is a severe case, then they will isolate you at the hospital, and hopefully not in the ICU under ventilation. But those are some of the things that the health, Sudbury District Health people are talking about, because people are asking, well, how do I get tested? Can I get tested? Is it available for everyone? Right now, it's not available for everyone. It's only available if you have symptoms. So which is why it's important to let the health professionals know if you're having any of those symptoms that are outlined on the sheets that were provided to you. So, so what are we going to do? Wash your hands, right on. No handshaking. Clean up your, disinfect whenever you can, all those surfaces, and yeah, wash your hands. It's just common sense. And yeah, for a regular update, follow TV5, buy a bingo card. I'll give you an update then, because you're going to be looking for something to do, especially if we're forced to limit gatherings and shut down schools, and we're gonna consider those decisions when we have to. but those are definitely options available to us. So any other questions? Anyone have any questions? Right on. So, Raymond. Only which one did all Raymond both dogs it. He could getting wig on one the cause you. He's gone the gaining or he mean to go me. Get on the cause now. Now get quite as good. You nishin away. He's been voyazi. But I quite magi no we didn't going on and so just reminded that we do have some of our own medicines that we do need to, that will help us use, that we can use them also. We know that cedar builds up our immune systems. And I know this for a fact because I know individuals who have a cup every day of cedar tea, and they're in their late 90s. Every day, that's their secret. That's what they said. And I also know that the smudges that we have are also kill bacteria. But you also have to believe in these things. And that's the message that Raymond shared, is that we do have our own medicines also. And if we continue to have faith and believe in our own system, then that's going to take care of us. Miigwech. So thank you to Teresa, Mary Jo, Terry, Yvette, Judy, and the whole team to help put this together. And as things come forward, then we will let you know. Miigwech. One question here, right? Well, we have taken a look at some of the guidelines for gatherings, because it is still, the risk is still low. However, what we have to be mindful of is the people that are participating. Where are they coming from? So that's one of the things that when we're talking about screening, that was a major point of our discussions. The people that are coming into the buildings and accessing programs and services, they're now going to be asked those questions. Stop. Did you come into contact with people? Did you go experiencing symptoms? Do you know, did you come from another country? Those are the kinds of things that we're going to have to, when we have gatherings like our ceremonies, are the people that are coming to visit and participate, are they showing symptoms? Have they come into contact with people with symptoms? So those are the questions that have to be asked. Miigwech, Chimiigwech, Dendim, Mamam Pimeno.